Adopting a child with HIV is a rewarding experience. With proper care, these children can go on to have long and healthy lives with a near normal life expectancy. HIV is the human immunodeficiency virus. It is the virus that can lead to acquired immune deficiency syndrome, or AIDS. The Center for Disease Control estimates that about 48,100 people in the United States contracted HIV in 2009. About 2,220 of those diagnosed were individuals 19 years of age or younger. Being diagnosed with HIV does not mean a person will be diagnosed with AIDS. It can take many years to develop AIDS, which is the final stage of the HIV infection, and occurs when the virus has weakened the body's immune system so that it can no longer fight diseases. With proper medication and an overall healthy lifestyle, the effects of the virus can be lessened. HIV can be detected in several fluids and tissues of a person living with HIV. It is important to understand, however, that finding a small amount of HIV in a body fluid or tissue does not mean that HIV is transmitted by that body fluid or tissue. Only specific fluids, such as blood, semen, vaginal secretions, and breast milk from an HIV-infected person can transmit HIV. These specific fluids must come in contact with a mucous membrane or damaged tissue or be directly injected into the bloodstream from a needle or syringe for transmission to possibly occur. HIV is not transmitted through casual contact with an HIV-positive individual. HIV is most commonly transmitted through specific sexual behaviors, such as anal or vaginal sex, or sharing needles with an infected person. It is less common for HIV to be transmitted through oral sex or by an HIV-infected mother pre-chewing food for her infant. The only way to know if you are infected is to be tested for HIV infection. You cannot rely on symptoms to know whether or not you are infected. Many people, most often adults, who are infected with HIV do not have any symptoms at all for 10 years or more. The following may be warning signs of advanced HIV infection: rapid weight loss, a dry cough, recurring fever or profuse night sweats, profound and unexplained fatigue, swollen lymph glands in the armpits, groin, or neck, diarrhea that lasts for more than a week, white spots or unusual blemishes on the tongue, in the mouth, or in the throat, pneumonia, red, brown, pink, or purplish blotches on or under the skin or inside the mouth, nose, or eyelids, memory loss, depression, and other neurological disorders. "30 medications have been approved by the U.S. government to fight HIV and AIDS, with others in development. HIV medications, also called antiretrovirals or ARVs, fall into several groups or classes. Each class attacks the virus a little differently and has a unique dosing and side effect profile. To maximize the impact against HIV, a treatment regimen is made up of drugs from 2 or more different classes. Most HIV-positive children take medications in the morning and at night. The medications are in pill or liquid form and are dosed based on weight and height until reaching the standard adult dose. Cost of medication can range in price from a couple of hundred to more than $1,000 a month. However, many insurance plans, including Medicaid and Medicare Part D, cover most of the cost for HIV medications. Additionally, the AIDS Drug Assistance Program, or ADAP, is a state-administered program in all 50 states for individuals and families burdened by prescription costs and who meet financial eligibility criteria, like lack of medical insurance. Universal precautions is defined as a method of infection control recommended by the CDC, in which all human blood, certain body fluids, as well as fresh tissues and cells of human origin, are handled as if they are known to be infected with HIV, HBV, and/or other bloodborne pathogens. As protection against the blood-related modes of transmission, health and child care workers, along with everyone else, should use universal precautions when coming in contact with the blood of all clients or bodily fluids containing blood. Staff members should adhere to the following universal precautions. Wear latex gloves when coming into contact with blood, skin, and mucous membrane cuts or any open skin lesion. Use gloves only for the care of one child, then discard the gloves. Wash hands after discarding the gloves. Properly dispose of contaminated materials exposed to blood, such as needles. Strict adherence to universal precautions prevents exposure to blood-borne pathogens, including HIV and hepatitis B. Nasal secretions, saliva, sputum, sweat, tears, urine, vomitus, and feces are not implicated in the transmission of HIV unless they contain visible blood. Gloves are not necessary for diaper changing unless the health or child care worker has open skin lesions, or the child has diarrhea or visible blood in the stool. Casual contact between infected and uninfected individuals does not transmit HIV. Nothing different is needed for HIV-positive children related to extracurricular or school environments. Your privacy is legally protected. You do not need to disclose your child's HIV status to schools, camps, or daycare workers. Everyone should be taught to use universal precautions if they come in contact with blood or body fluids from another person. When all is stable, children with HIV come to the clinic quarterly, or more often when there are acute issues. Blood is usually drawn every 3 months, or more frequently if needed. Dental care is also very important for children with HIV. Parents should help children learn good dental hygiene and be attentive to any signs of infections in the mouth. Children with HIV go to school, join Girl or Boy Scouts, participate in sleepovers, play sports, and lead normal lives like any other children. All schools and extracurricular venues are mandated to follow universal precaution guidelines. With medication management, a healthy lifestyle, and consistent treatment, HIV-infected children are living well into adulthood with significantly improved life expectancy since the beginning of the epidemic. People who are HIV positive work and go to school. They do not need to disclose their HIV status to employers, teachers, or roommates, and are legally protected from discrimination based on their HIV status. However, HIV-positive people are legally responsible to disclose their HIV status to sexual partners or those with which one is sharing needles. People with HIV can start families and have children. With treatment, transmission from mother to infant is preventable. University of Chicago Adoption Center, or UCAC, partners with families to provide compassionate, state-of-the-art care to children with HIV and AIDS. To date, the Pediatric and Adolescent Care Team has provided services to over 400 individuals under the age of 25 who are infected by or exposed to HIV. Our team has cared for adopted children who have come home with extremely high levels of viremia and significantly suppressed immune systems. With proper assessment and by initiating treatment with antiretrovirals, the immune systems of these children can be strengthened and the level of virus driven down to extremely low levels. UCAC can assist with both pre-adoption assessments and even provide in-country consultation when necessary. Our 5-visit post-adoption evaluation helps families welcome a new child into their home while synthesizing disease-specific information and integrating the care of this child into normal family life. The post-adoption evaluation includes medical, developmental, and behavioral care. UCAC is part of University of Chicago Medicine Comer Children's Hospital, with access to the highest quality pediatric infectious disease subspecialty care. Our care team has access to the most current national guidelines and research involving the care of the child or adolescent living with HIV. After the 5-visit post-adoption evaluation, the specialty infectious disease care continues for HIV-positive children on a quarterly basis. Our staff monitors the child's growth and development, regularly assesses for evidence of antiretroviral medication side effects, and adjusts medication doses as the child grows.